English for Nursing by محمد Amin. Part 2 اللغة الإنجليزية للتمريض. اعداد المدرب محمد أمين. 2. Professional and technical nurses. Hospital nurses. Most professional and technical nurses work in hospitals. They work with doctors and other medical personnel in caring for patients. Nurses function in a great variety of roles in the hospital. They work as members of the surgical team in the operating room. They work on intravenous therapy teams, giving blood transfusions or injections of drugs. As members of physical therapy teams, they help patients learn to function with disabilities or illness. Nurses also care for newborn babies. Nurses manage the daily care of patients. They see that patients have a daily bath and that they eat proper foods. They make sure that patients do exercises or have treatments that will aid in recovery. Nurses administer prescribed medicines to patients and teach patients to care for themselves. Nurses keep a watchful eye on patients and keep track of any changes in physical condition, mental attitude, or reaction to drugs or other treatment. The well-being of patients is of first importance to nurses. They take time to reassure worried patients and boost the patient's morale. Nurses are taught to recognize and understand patients' needs and to provide emotional support as well as physical care. For example, they take time to play with a child, read to a person who cannot see, or write letters for a patient who has a broken arm. A head nurse has charge of the nurses and patients in a unit or in some other section of the hospital. With additional education, a nurse may become a supervisor and direct several units, or may specialize in one kind of nursing. For example, a neonatal clinician is a nurse who specializes in the care of newborn babies. A cardiovascular specialist specializes in caring for heart patients. Specialization requires a master's degree, which also prepares a nurse for teaching, supervision, or administration. In other institutions, such as nursing homes and mental hospitals, nurses perform in much the same way as hospital nurses. Specialized knowledge or training usually is required because of the special needs of the patients. Many male nurses work in mental hospitals. 2 private duty nurses work in hospitals or in private homes. Unlike other nurses, they are employed by the patient rather than by the hospital. Private duty nurses may devote all their time to only one patient who needs constant care. Sometimes they may attend a small group of patients. Most hospitals keep a registry or file of nurses who are available for private duty. 3 community health nurses. Community health offers increasing opportunities for nurses. Those who wish to enter this field must take special college courses that are approved for community health work. Community health nurses usually help take care of large groups of people in their homes and communities. Most of these nurses work for government or private agencies. Visiting nurses are community health nurses. So are the nurses employed by city, county, or state health departments. Community health nurses may go into homes to care for patients who have just returned from hospitals. They often teach patients with chronic illnesses such as cancer and diabetes how to care for themselves. They also teach patients and their families about proper diet, personal cleanliness, and other ways of preventing illness. Community health nurses may take part in many community projects, such as polio vaccination and immunization programs for communicable diseases. Some of them work in schools and summer camps. 4th, Occupational or industrial health nurses work in factories, stores, banks, and many business offices. These nurses give first aid to the injured. They give employees physical examinations, screen them for illnesses, and treat them for colds, bruises, and other minor ailments. They also promote programs to prevent accidents on the job. 5. Nurse practitioners, also called nurse associate, are professional or technical nurses who have had additional training in a certain area of specialized practice. For example, some nurse practitioners specialize in geriatrics, caring for the aged, and others in pediatrics, caring for children. Nurse practitioners perform many tasks that were once done only by physicians. These nurses give physical examinations, diagnose and treat minor illnesses, and advise patients on health problems. By administering much of the daily health care, nurse practitioners free physicians to treat patients suffering more acute ailments. Most nurse practitioners work in private clinics or doctors' offices, or in a group practice with physicians or other nurse practitioners. 6. Other nursing careers. Many professional nurses combine the professions of teaching and nursing. To teach in a school of nursing, a professional nurse must have advanced college preparation. A doctoral degree in nursing is usually required for teaching. Professional and technical nurses may work in clinics or in doctors' and dentists' offices. Many nurses work as nurse researchers. They conduct research on how to relieve patient suffering. For example, nursing research has discovered how to decrease vomiting in patients who undergo chemotherapy, treatment with drugs. Some nurses hold positions in nursing organizations. Others write books and articles about nursing. Companies that manufacture drugs and medical equipment often employ nurses as consultants on their products. Nurses serve in the Army, Navy, and Air Force. Other branches of the government, such as the Department of State and the Department of Veterans Affairs, have nurses on their staffs. أهم الكلمات English term, Arabic translation, professional nurse, ممرضة محترفة, technical nurse, ممرضة فنية, hospital, nurse, ممرضة المستشفى, medical personnel, الطاقم الطبي, surgical team, الفريق الجراحي, operating room, غرفة العمليات, intravenous therapy, العلاج عن طريق الوريد, blood transfusion, نقل الدم, drug injection, حقن الأدوية, physical therapy, العلاج الطبيعي, disability, إعاقة, newborn baby, مولود جديد, recovery التعافي, administer medicine, إعطاء الدواء, reaction to drugs, تفاعل مع الأدوية, well-being الرفاهية, emotional support الدعم العاطفي, head nurse الممرضة الرئيسية, supervisor مشرف مشرفة, specialization تخصص neonatal clinician اختصاصية حديثي, الولادة neonatal clinician اختصاصية حديثي, الولادة cardiovascular specialist أخصائي القلب master's degree درجة الماجستير mental hospital مستشفى الأمراض النفسية private duty nurse ممرضة خاصة registry سجل قاعدة بيانات community health nurse ممرضة صحة المجتمع chronic illness مرض مزمن personal cleanliness النظافة الشخصية communicable disease مرض معدي immunization التحصين التطعيم occupational nurse industrial nurse ممرضة مهنية صناعية first aid الإسعافات الأولية screening الفحص المسح الطبي minor ailments أمراض بسيطة nurse practitioner ممارس التمريض geriatrics طب الشيخوخة pediatrics طب الأطفال diagnose يشخص group practice ممارسة جماعية nurse researcher باحثة في التمريض chemotherapy العلاج الكيميائي consultant مستشار Department of Veterans Affairs وزارة شؤون المحاربين القدامى